I'm going to do a double act. I'm going to do a bit of a warm-up and then I'll hand over to Clive to do a demo of our, I don't know if we call it a beta version, but it's beta minus perhaps. Where are we? Okay. So I don't know how many people here were at the celebration event in December, but this is going to be very similar. So sorry about that. So we started off, just going to start off explaining how we got to this. I'll go through the slides quite quickly because I want to give a bit more time to the demo. But we were asked to do some work looking at how to embed telehealth within a trust. I'll whiz over these bits actually. Yeah, we were asked to do a case study with the North West Coast AHSN with a trust within the North West Coast area, looking at how we could help them to adopt telehealth technology. And we combined this with CSC as our industry partner, who were doing business case analysis. So we had two processes that we did, which we thought dovetailed quite nicely together. And the trust in question was, their driver was to improve management of long-term conditions patients, and they asked us to look at COPD. And they were looking particularly at how could they, it was a community trust, looking at how could they reduce unplanned admissions and readmissions and encourage people to use more self-management. So we talked to a whole lot of people, people who worked in the trust. We talked to some of their partners in the health economy. We talked to some patients and various other advisors in the sort of wider stakeholder group. And we came to the conclusion that we actually couldn't recommend that they implement telehealth because of various limitations in their organisation and in their partnerships. First of all, this trust was very weak on their community care and intermediate care structures. They had a situation where there was a strong acute provider, but then there was nothing really for COPD patients who had an acute episode. They were then just referred back to the GP. There was no sort of special COPD nursing team, for instance. There were also conflicting services already in place, which confused the GPs and confused the patients. And they weren't really talking to each other about how they were going to provide those. There was not a good sort of situation with regard to integrated care. They weren't all working together on shared objectives. And we also thought they actually had a lack of clarity about what clinical problem they were trying to solve. So I think Graham said right at the beginning it was something to do with not really understanding what the problem was. They just thought, this is a nice idea, we'll try this, it'll solve lots of problems. And therefore understand how the patient could benefit. So we'd concluded that that organisation was not telehealth ready. There is an issue which I think is quite common, that people think we've got these problems, let's bring some technology in, and they don't really think through what the problems are, how they're going to solve them. And the other issue, which I think we need to recognise, is that going on with all this, there's a lot of budget cutting going on, so that tends to make things a bit difficult in selling your new innovation to the staff, and you have to be quite careful about how you think that one through. So we then went away and we went back to the HSN and said we can't really do what we wanted to do because we don't really think this trust is in the right kind of situation to implement telehealth. So we talked that over with Liz, Ashel Payne and others, and came up with the idea of developing a telehealth readiness tool. The idea of this tool is it's something that organisations can self-assess, look at a number of elements, and they can then which I'll take you through in a minute, and then score themselves, and then they can go away and look at the resources and work through some sort of case examples, and then they can come back and try again and hopefully get a better score. I think actually some of these things are a lot easier said than done. It's all very well for me to stand here and say it, but when I look at some of the problems, I do have sympathy, but I think there's some shared practice we can offer people. And it's been developed. We're hoping the next stage we'll pilot it and then hopefully refine it a bit further. Sorry, I've gone the wrong way. Okay, so this is the telehealth readiness tool. We looked at 5 elements, which are shown in the diagram there, and looked at those are the key building blocks, and there's a set of questions in each one. I will now, I think, pass over to Clive to talk about it.
Thanks, Alison. Yep. There is no symbolism with the dandelion, by the way, just pointing that out. It was the graphic that our designer had available at the time. There will be more appropriate graphics coming soon. So there is lots of whizzy tech around, and the answer is not just a technological one. I mean, for example, I'm wearing a health patch on me at the moment, monitoring all my vital signs, which is fantastic, but that's not the be-all and end-all of a telehealth solution. And actually, it's more about the complete end-to-end solution. And as Dave was saying, you have to think about, for example, how many people are going to be needed to monitor the data that's coming in from people, because as you scale up, these things are aspects that you really have to think about, and you have to plan that in advance. And so what we were seeing were people who thought that technology, as you've said, is the answer, but it's not the answer, it's the means to an end. And actually what you've got to think through is, what are the challenges in your organisation or in your local health and care economy that you're trying to solve? And if you think through what those challenges are, 1, you can plan better, but 2, you can measure better when you start implementing and work out what impact you're having. So from this, you can see the initial screen, and we're asking for some information. Now, I'm asking all of you, if you have the time, to go away and try this. I was going to do a live demo using the Wi-Fi here, but if any of you have used the Wi-Fi here, we haven't got until 5 o'clock to do this. So, if you can go away and have a go at this, it's a very simple URL to remember. It's www.readyfortelehealth with a number 4, so readyfortelehealth.com. Okay? And if you wouldn't mind going away and having a look and trying it, the questions are in your pack, so for you to have a better look at those. And we are really keen to get your feedback on those questions and also the answers. Are the answers the right ones? We know that the answers will not cover every single eventuality. They can't. It's a Likert scale of 5 answers. We have to try and, cover up the grey bits. It's not black and white, but we've done what we can. But if there's any of the wording in there that you think could be improved, if there are ways that you think it could be made better, please do tell us. And there is an email address for Alison on the back there, and she will be the gatekeeper of all of your comments. There is boxes on the front to gather personal information. The reason for doing that is not because we're then going to spy on you and put things on your computer, but although it's an interesting idea, and I'm sure there are several others who might want it. But actually it's because in the future what we'd like to do is to email the results back to you, and also the list of resources that you'll see at the end. Okay? So there'll be a screen that comes up, and it works through each of those 5 areas that Alison mentioned, and on each of those there is a question, and then there are 5 answers. You have to answer every question. There is 1 answer selection for each question. It's multiple choice. You click in the little box and it comes up with a circle. You have to do that on every question, okay? And if you try and get to the next screen and you don't answer a question, the questions that you haven't answered are highlighted in red, and the screen will automatically go back up to that first unanswered question. So that should show you if you've missed any of them out, okay? What we've tried to put in are some very basic learning resources. So where you have areas of weakness or where your planning is not what it maybe ought to be on a particular question or category, there are some resources that are shown to you. Now, this is a very first sort of pass at a list of resources. Again, if you have ideas for these, we're very keen to get them through to Alison. We are refining those now. This is definitely not the final list. And at the moment, it's based on the overall category score. In the future, it will be based on your individual score per question. Okay? And then what you'll see is as you work through, it shows you at the top your progress as you're working through the tool. So you know how far you've gone through the 5 screens. Okay? And there is a score on each question, as you can imagine. And when you get to the end, there is this interesting spider chart that comes out that shows you on the 5 different axes what your score is for each of those categories. And depending on your score, you will then get a list of tailored resources at the bottom for each of those areas where you have shown maybe some lack of planning or the need to do further planning on what it is that you want to do. We haven't called it telehealth all the way through. We've talked about an initiative that you want to do. That could be anything. It could just be buying tech. It could be a fully managed service, anything in between. But this is all about planning. And to be honest, actually, this could probably be used for most technology-based change initiatives that you want to do in healthcare. A lot of the questions would be very, very similar. And where it says initiative, instead of thinking telehealth, think something completely different like electronic health records or personal health record. Okay? So on that, I'll finish. I do urge you to have a look at it. We're really keen to get your feedback. We'd love you to try it and let us know what you think. Please do go ahead and try it. Thank you.
I just to say